The Kenya Medical Practitioners, Pharmacists and Dentists Union KMPDU has raised concerns over the Social Health Insurance Act 2023, saying it is an impediment to health care access by Kenyans. Addressing the press today, KMPDU leadership have expressed their reservations on certain clauses and how they would impact health service delivery in the country. According to the union, all their proposals to the Parliamentary Health Committee were ignored. Alice Diana with this story.
The recently enacted Social Health Insurance Act 2023 has continued to receive criticism from different quarters in the country.
Solidarity.
The Kenya Medical Practitioners, Pharmacists and Dentists Union KMPDU is the latest to express its disappointment with the act, saying the government is about to meet justice against not only civil servants but Kenyans in general.
So every month, every civil servant have been paying the 1,700 plus an extra medical allowance of 3,500. That is totaling up to 5,200 with 5,200 per month. With this bill, which has just been enacted, it then means that the monthly deductions is going to increase threefold. That means if you are paying 1,700, you're going to pay 5,000. If you're paying 500, you'd pay 1,500, depending on your level of salary. But if you look at our members, it means that annually they'll be paying 102,000 for the Social Health Insurance Act. You cannot promise universal health care when almost 3 million Kenyans will be going to private hospitals, will be going to faith-based hospitals, or will be going to other public hospitals, and they have to sell their properties to access the care. It must come out very clearly that these civil servants with their dependents must be given a comprehensive cover, and if that is not possible, then their medical allowance must be returned forthwith. And that's the demand we are giving to government on that.
According to KMPDU, 80% of Kenyans work in the informal sector, and this law is going to hurt them dearly by making them contribute upfront the entire annual amount, unlike their formally employed counterparts who will contribute monthly.
If you are not able to pay this, in this particular article, you will not be able to access care. Then how will the universal health care be achieved when we know that there are many people who will not be able to pay that upfront? What condemns them if they are not salaried? That means that they have to pay all at once. Is it that the government doesn't trust its own people to make sure that they all pay even if they don't have? In fact, the bill goes ahead as saying that they'll be provided with premiums, which looks like loans. To whose benefit if you are not able to pay for this particular social health insurance fund?
On the primary health care fund, the union has demanded that the fund be disbursed to the counties by the Commission of Revenue Allocation and not managed by Social Health Authority, as this will undermine devolution and affect the service delivery by perennial delays.
If indeed the government wants to ensure that there is a primary health care, there is a universal access, that level 1, 2, 3 must be accessed, then these funds need to be disbursed ante to the hospitals within level 1, level 2, level 3. These funds need to be provided to those counties so that the counties can actually employ health workforce, so that the counties can actually buy the drugs, because these are tax-based funds. The primary health care fund is a task fund. It's not a fund that is based on the contribution.
Alice Diana, Hope TV News Watch.